Hi, it's Sator here from Hierarchy Acupuncture and Herbs. In this video, I'm going to share with you some tips on how to deal with the persistent annoying heel pain. Does it ever happen to you that first few steps you take in the morning are painful, or maybe your feet start hurting after walking for a while? The pain is sharp and feels like a needle is poking your soles every time you stepped on the floor. You may have tried expensive insoles and even visited a foot doctor who diagnosed you with a plantar fasciitis, a condition you may have never heard of before. Plantar fasciitis is a condition where the plantar fascia, a thick band of tissue that connects the heel bone to the toes, become inflamed and painful. It is a common cause of heel pain, especially in runners and people who spend a lot of time on their feet. In severe cases, the doctor may recommend a steroid injection or, in worst case, surgery. However, there are 6 simple steps you can do at home to take care of yourself and avoid risky injections or surgery. So first, I'm going to talk about the 6 most common causes of plantar fasciitis. Then I'll be sharing some helpful massages and stretches that you can do to alleviate the pain associated with these causes. You should feel some relief right away, and if you do it every day, you'll see a big difference. So let's get started. What causes plantar fasciitis? Plantar fasciitis is a condition that can be caused by 2 factors, external and internal. External factors are due to environmental changes that leads to improper impact on the sole of your feet, resulting in pain. This is a relatively easier fix, as you can simply change the environment or habit for a while to help your feet recover. Internal factors, however, are more complex and are related to the body's mechanism. As the body is connected like a chain, if it's not working properly, the sole of your feet may endure a lot of impact, especially from activities like running, jumping, or even walking. If you apply too much force or strike it in the wrong way, it can cause inflammation and pain. External factors. Number 1, overuse. The number 1 cause of plantar fasciitis is overuse. Statistics shows that 60% of patients with plantar fasciitis work outside and are on their feet all the time. And the research has found that somewhere between 4 to 22% of the runners suffer from plantar fasciitis. And number 2, weight gain. As I mentioned earlier, when you run, the sole of your foot is the last part of your body to hit the ground. Even a slight increase in your weight can have a significant impact on it. For example, if you gain 10 pounds, the force on the sole is increased to 20 pounds when you walk. And when you run, it can increase up to 6 to 10 times. This impact can be quite substantial, and you may wonder why your heel is painful when you gain weight. Number 3, improper footwear. Sometimes people complain of the discomfort after switching a new pair of shoes. This happens because the shoes may not have enough cushioning or support for your feet. If you have a flat feet, it's best to avoid thin, flat shoes with unsupportive insoles or flip-flops. Wearing such shoes can put extra pressure on your feet and it eventually leads to pain. So it's always better to choose shoes that provide ample support and cushioning for your feet. Internal factors. The previous 3 reasons are very common and can be easily fixed. However, the next 3 causes are related to your body's mechanics. The human body is like a chain, and if one part is misaligned, another part compensates, leads to an increased force on the particular part. In this case, your feet bear the brunt of this force. While your symptom may seem like isolated issues, resulting the root cause of the problem is essential to prevent the pain from recurring. Number 1, flat feet. The flat feet are the common issue doctor diagnosed leading to a plantar fasciitis. Having flat feet means that your feet tend to roll inward causing all the way to the concentrate on the inside of your sole. It's similar to driving a car with a flat tire. This is why the insoles are recommended to adjust the angle of your feet. But it's just a temporary fix, like you put a band-aid on the scar. Number 2, tight calf. When examining the anatomy of your foot, it becomes apparent that most of your muscles in the calves is actually located on the sole of your foot, like posterior tibialis, flexor digitum longus, and flexor hallucis longus. This means that if you have tight calf muscles, it can also affect your feet, leading to a development of plantar fasciitis. Number 3, weak or tight hip muscles. It's not commonly known, but if you have weak or tight hip muscles, your hip tends to rotate inward, which is called internal rotation. This internal rotation affects your thigh and knee, causing them also turn inward. Consequently, your feet will be inverted due to these reasons. Having inverted feet is similar to having a flat feet and can cause inflammation of the plantar fascia, leading to a pain. For those causes that I mentioned earlier, there are 6 simple steps and easy massage and stretch that you can do at home to release plantar fascia or general heel pain. The first part is massaging the actual foot and calf with your fingers, and the last 3 parts are easy stretching. Remember, if you ever feel too much pain or soreness, taking a break and rest is okay. Always listen to your body and don't push yourself too hard. Step 1. Foot massage. Please have a seat on a chair or the floor and grab your affected foot. Let's imagine there are 3 lines. The first line should start from the root of your big toe and go all the way to your heel. The second line should start from the root of your center of your toe and go all the way to the heel. The third line should start from the root of your outside of your toes and go all the way to the heel. Let's begin by applying pressure to the edge of your big toe using your thumb. The pressure should not be too hard or too soft, but just enough to make you feel slightly sore. Rub sideways. Repeat the motion 15 times before you moving on to the next part of your foot. Repeat the process until you reach the edge of your heel. The second line starts the root of your second and third toes. Use your thumb and apply pressure until you feel the right pressure. Rub sideways, repeating the motion 15 times before you moving on to the next part of your foot. Repeat the process until you reach the edge of your heel. Begin by locating the third line, which starts from the root of your fourth and fifth toes. Using your thumb and rub sideways on this line. Repeat this motion 15 times before you moving on to the next part. Continue this process until you reach the edge of your heel. Repeat this cycle 2 more times. Step 2. Calf massage. Because there are muscles like posterior tibialis, flexor digitum longus, and flexor hallucis longus that are attached to your shin bone. I want you to release these tight muscles. Please visualize two lines. The first line starts from the inside of your ankle bone and goes up to your corner of your shin bone. The second line starts from the edge of your Achilles tendon and run up to your middle of your calf muscle. To massage your calf, use your thumb and press against the bone gently. However, make sure not to apply too much pressure as there are blood vessels in this area. If you feel any pain, skip this area and move on to the next part. Rub upward at the edge of the bone 15 times before you moving on to the next part until you reach the edge of the shin bone. For the second line, start at the edge of the Achilles tendon and rub up and down 15 times before you moving on to the next part. Repeat until you reach the middle of the calf. Please repeat this cycle 2 more times. Step 3. Calf stretch. The second thing you should do is stretch your calf. First, place your hands on the wall and put your toes on the wall as well and straighten your knee. This stretch mainly focuses on your gastrocnemius and plantar fascia itself. Once you feel the stretch in your calf, hold it there for 15 seconds. While stretching, take a deep breath and relax. Repeat this 2 more times. Step 4. Hamstring stretch. To stretch your hamstrings, please put your foot on the table with your knee straight. Try to touch your toes and take a deep breath as you exhale. Hold this position for 6 seconds, then relax. Repeat this set 2 more times. Remember, your body is all connected like a chain, so tight hamstring can cause problems too. Step 5. Hip stretch. To stretch your muscles in your hips, such as gluteus maximus, medius, minimus, and piriformis, you can lie on your back, cross your one leg over the other, and place your ankle on the opposite thigh. Then grab your back of your thigh and gently pull your leg towards your chest. Hold this position for about 15 seconds before releasing. You should feel the stretch in your buttocks. Repeat this cycle 2 more times. Step 6. Foot bath with Epsom salt. Just one more thing before you go. I recommend doing a foot bath to warm up your feet. All you need is to grab a bucket and fill it with some hot water around 100 degrees. If you have any Epsom salt, toss in a handful to make it even more soothing. Then just sit back and soak your feet for about 20 minutes. This will help warm up your muscles and fascia and soften your tissues, which will speed up the healing process and reduce the inflammation. Performing these exercises every day can bring about several benefits such as faster healing, reduced swelling and pain levels. This can help you to regain your ability to walk or run like before. But if you still face difficulty with these activities, you can try alternative treatment like acupuncture before considering corticosteroid injections or surgery. I hope you or someone you know can recover from plantar fasciitis sooner. Thank you for watching and see you in my next video. Take care. Bye.